Hello everyone, my name is Elva and today I'm going to be talking about PAP smears. So let's begin. What is a PAP smear? A PAP smear is an examination done on women. It examines the cervix, also referred to as the vagina. More specifically, a doctor collects cells and mucus from the lower parts of the uterus, which sits on top of the cervix, as seen on the left side of the picture. It helps detect precancerous cells as well as cancerous cells in the cervix. They looked for uncontrolled cell growth in the cervix, as seen on the picture to the right. This is referred to as dysplasia, which may lead to cancer over the years. As stated before, a PAP smear detects precancerous cells ahead of time. Abnormal cells form in organs such as the cervix, vagina, vulva, anus, and esophagus. Atypical squamous cells of underdetermined significance is found to be the most common infection. It's the image on the left shows you what normal cells and tissues will look like, epithelial tissues will look like, and on the right is just an image of the cervix. Inflammation and low hormone levels are some signs of possible infection development in the cervix. Often these infections go away with the help of your metabolism, but many of the times, not many times, but often it can lead to cancer, which is important to get a PAP smear done to avoid. Human papillomavirus, also known as HPV, is an infection that can lead to cervical cancer. There are over 100 types of HPV, but only about 13 are cancerous. More specifically, HPV 16 leads to cancer. Other infections include the low-grade squamous cells, intraepithelial lesion, which is the first grade that can cause infection in the cervix. High-grade squamous cells intraepithelial lesion is more likely to lead to cancer, and that's due to chronic infection in the cervix. IES is another infection which tells us that there is cancer in the cervix. And then we have cervical cancer, which is cancer in the cervix. And that is due to infection, perhaps the HPV 16 infected the cervical area in a woman. And when you get your test results back, a negative means that you have no cervical cancer. A positive means that you do have possible infection or cervical cancer. You can also get a false negative, which tells you that you don't have infection or cancer, but in reality you do. That's why it's important to get checked frequently. How often should you get a PAP smear done? It's recommended to get it one time every 3 years, especially if you're experiencing abnormal vaginal bleeding, pain urinating, vaginal discomfort, or unpleasant cells. It's important to get tested because this can spread to surrounding organs such as your uterus, bladder, even your lymphatic and circulatory systems. If you get a positive result back, or if you have abnormal cells, doctors recommend that you get a colposcopy done. A colposcopy done, colposcopy is a follow-up exam which doctors look into your cervix and they get tissues which they further examine in the lab. They examine the cervix, vagina, vulva, and they magnify it with a colposcope. They look into your vagina with the colposcope instrument, and they further examine it in the lab. Some treatments include HPV vaccine, which children can get from between the ages of 11 and 12, but they can also get it as early as 9 years old. You can also be taking continuous PAP smear exams and consult with your doctor. Here's some extra references and that you can check out if you need any more information. Thank you.